Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good morning, Philippines. You're watching the Business Portal, your gateway to health, beauty, trends, and opportunities. I'm your host, Dr. Cenica for What's Up, Doc? What a very beautiful morning. And of course, we have a very hot topic all about facial contouring. And before anything else, I would like to introduce to you my co-host, no other than the beautiful Dr. Jonnamae Cenica. Good morning, Doctora.
Thank you. Good morning, Dr.
Yes,
John.
and you have a very nice hair, huh?
Thank you.
Courtesy of?
Sariling sikap yan.
Sariling sikap. Very good, very good.
Ayan, thank you.
Okay.
And good morning, Philippines. Good morning, Dr. John. And good morning to all those who are watching us weekly. And for you guys, this is a very special topic. Lalo na sa mga kababaihan. Kasi mga girls talagang very interested dito sa sinabi mo nga, facial contouring. Mamaya ipapaliwanag natin, ano ba tong facial contouring na to?
Yes.
Ito ba yung inooperahan?
Kasi alam ko yung facial contour is that you have to really have a very good facial angle.
Okay.
And it's not only deal with the nose, but also with the cheekbones, with the jaws, with the chin, and of course with the eyes.
Okay. Dr. Cenica, ikaw cosmetic surgeon ka.
Yes.
In a cosmetic surgeon's point of view, ano ba yung ina-achieve natin pag sinabi nating facial contouring? Gusto ko po magpa-facial contour. Ano ba yung ginagawa natin dito? Ano yung ina-achieve natin?
Discuss natin, of course, together with our expert, cosmetic surgeon. But before anything else, I would like to introduce to you our guest for this morning.
Yes.
A very beautiful model. She's also a member of the 24K. Yan. Siya si no other than Miss Farina De Paz. Good morning, Miss Farina.
Good morning, Miss Farina. A beautiful morning.
Yes, tingnan mo naman. What a very nice smile.
Yes.
Ayan, oo. And of course, we have our expert, and I could say an icon in cosmetic surgery, no other than our favorite, Dr. Rayran Lau. Yeah, Dr. Lau, good morning.
Dr. Lau,
good morning,
yes,
good morning, Dr. Cenica. Good morning, Dr. Cenica. Sorry for the voice, ha. Medyo under the weather.
Hindi naman
nag-concert kagabi. Nag-concert kagabi si Dr. Lau.
Yeah. Oh. Well, you know, we'll be talking all about facial contouring. And of course, for our televiewers, you can text your messages at 0922-891-6761. And again, it's 0922-891-6761. And please indicate your name
and
your location, where you are right now, right in your in front of your screen. And we will be answering all the questions, possible questions that ma-accommodate natin. Kasi last time, ang daming texters, and sometimes we cannot accommodate it in television. But definitely, we will
try to answer all your questions.
We want to assure our televiewers that hindi man natin ma-broadcast sa television yung questions nila, but we could text you back
still answer
whatever questions that you're gonna ask to our experts.
Yes.
Of course, our topic for this morning is facial contouring. A very nice topic, no? Kasi of course, the face is the most sensitive part of our body. Dr. Lau, what is all about facial contouring?
Ano ba ito sinasabi nila itong facial contouring in cosmetic surgery? Sige.
Okay, facial contouring means yung from the word itself, contour. May mga pasyente na gusto na lumiit ang muka.
Okay. Medyo lumaki ang cheekbone.
Either lumaki o
cheekbone.
lumiit.
Sinasabi nga natin is dagdag or bawas.
Okay.
Yun yung kinokontour. Depende doon sa requirement ng face ng pasyente. Remember, we have a symmetry sa pasyente na yung sa nose, sa cheekbone, para masabi natin na perfect yung face.
Okay.
So, may sukat na ginagawa yon. So, kapag ang isang pasyente is nalalakihan sa pisngi, yung tinatawag na chipmunk na cheek.
Okay,
Yun, may mga
chipmunk.
procedure
Okay.
na ginagawa. Meron tayong non-surgical procedures for facial contouring. We have surgical procedures naman for
Okay.
contouring. Yes.
Okay. Now later on, we will be also demonstrating a, I could say, a machine that
procedure
will
siya. Yes.
live demonstration how one procedure na pwede natin i-contour ang face ng
It's
isang
called the
tao.
biotherm, am I right?
Biotherm,
Yes.
right,
This is a non-surgical procedure, tama, for facial
Right.
contouring.
Kasi I know that when you say body contour, you have to contour. Face is just a general term,
Oo.
but there specifically the anatomical part of
Yes.
the face, like the chin, the jaws, the chin, the nose, the eyes. And we have a very typical patient. Ayan. A very beautiful, a perfect patient. Well, siguro later on, we will also be showing her picture
Oo.
before the procedure. Would that be okay? And of course, Miss Ferina. Miss Ferina, what does makes you come to a cosmetic surgery clinic? Wherein, ano bang problem mo noon?
Anong problem mo dati?
Actually, kasi ayoko talagang yung mga surgery.
Oo.
Takot ako kasi
Yeah.
I really love the way I look now.
Okay.
I'm satisfied with it. But every time I gain little weight lang, kahit
Okay.
yung konti lang, parang ang taba-taba ng face ko.
Mukha
Kasi
agad
oo,
yung tumataba
Yeah.
sa'yo.
Yung mukha
Okay.
agad yung una mong makikita pag like, kunyari, nag-gain ako. Sabi ng mga friends ko, oh, tumaba ka kasi because of my cheeks. Kasi,
Okay,
Yeah.
okay.
ano siya, parang mabilis magbilog.
Okay,
agad.
oo.
Bilugan
Bilugan talaga.
Ang face mo before is really
Bilugan talaga yung mukha.
Kasi mapanga ako, so mataas yung cheekbone ko.
Oo.
Ang tendency, yung cheeks ko, parang medyo
Parang,
fat.
yeah. oo.
fatty.
Oo,
Yeah.
kahit sabi mong nag-lose na ako ng weight, hindi mo
Naiiwan
pa rin,
minsan yung
may
face.
iwan
Okay.
Pa rin. So,
Oh.
I tried for options.
Okay.
Yung una was, ang ni-refer sa akin RF, pero
Yeah.
parang ang tagal.
Mga non-surgical
Oo,
procedure.
non-surgical
parang, for me,
muna.
parang wala namang effect.
Oo.
So,
Yes.
nagpunta ako sa Johnson to check kung ano pa yung other options about
Okay,
it. So,
oo.
ayun.
Okay, so kay Dr. Lau, anong procedure yung na-recommend natin kay Miss Farina?
Yes, so yung when she came to the clinic, yun nga, sinabi niya yung RF.
She tried it
she
already,
tried it.
okay.
Kaso nga lang, medyo matagal talaga
Matagal.
ang result ng RF.
Okay.
You have to do it on a regular basis, on a
Oo.
weekly
And
basis.
dapat religiously kung
Yes,
ginagawa, hindi
habitually.
pwedeng patigil-tigil.
Oo.
Okay.
Tapos sabi nga niya, pag nag-gain siya ng weight, tumataba yung dito niya.
Okay.
Which is the buccal fat pad or the B-chat, yung tinatawag na
Okay.
fats dito, isa sa pinakamahirap tanggalin
Paliitin.
or paliitin.
Palitin.
Okay.
Yeah.
Pwedeng
Kasi siguro
lumiit.
medyo malalim ng konti
Yes,
yung
pwedeng,
buccal fat.
pwedeng lumiit yung chan mo, yung arms mo.
Pero yung mukha mo,
pero
hindi
yung
pa
mukha
rin.
mo, sometimes medyo mahirap.
Okay.
So we offer the buccal fat removal na tinatawag
Siguro
namin.
probably Dr. Lau, we can also show
Yeah,
her
oo.
picture.
She
yung
has before
ni
and
Doc- ni
after
Doktora.
pictures.
Ni Miss Farina De Faz, no? Pwede natin ipakita yung picture niya. Sa, yan.
Ayan,
No,
ito-
not that, but the picture that before. Yan yung live, siya yung picture niya ngayon, no?
Kasi actually nakita ko nga, yan yung
Ayan,
picture
go.
niya
Ayan
before.
yung
Oo,
picture
medyo
niya.
medyo
You can-
chubby cheeks.
you
Chubby
can,
cheeks nga siya.
Akala ko si ano siya, no? Artista si, may kasamukha siya. Ayan siya
That
ngayon.
was the
This is her
after
picture.
Picture.
You see how beautiful Miss Farina
Right.
is.
Oh, at saka medyo naging prominent yung cheekbones. Pero you didn't put fillers naman.
No.
Okay.
Wala,
Mataas
Talagang
Talagang
mataas
oo.
talaga yung
Can
cheekbones.
when can you
Okay.
see again, yeah, there you go, yung picture
Yung
na yun,
before,
no?
oo.
Makikita mo na talagang very prominent yung facial
Yung
Nasa
cheeks
fat
lahi ko
area.
Yung mataas yung
Right,
cheekbone,
oo.
tapos yung jawline.
Okay.
Mas,
So you recommended the buccal fat removal.
Yes.
Tama ba? Okay, what is this buccal fat removal? Is this a surgical, non-surgical procedure? Paano po ba ito?
It is a surgical procedure.
Okay.
Good thing about this procedure is it is scarless. As you can see, wala siyang ka-scar.
Walang scar sa
Yes,
cheeks.
the incision.
So,
or-
saan ang opening niya?
Yes, nasa loob. Nasa
Sa loob ng mouth.
Intraoral,
Nasa
yung
yes.
Ah, so para kang binubunutan ng ngipin nun. Parang
Yeah.
ganun lang. Okay.
Actually, wala kang pain.
Oo. Yeah.
Kaya pumayag din ako sa procedure, malinis.
Malinis.
Walang scar.
Nobody could tell that there was something there, right?
Before kasi, we used to do liposuction sa face.
Okay.
Problem is, meron kang
May
maliit
incision.
na
Saka
scar.
minsan nagkakaroon pa ng parang hematoma or
Yes,
bruises.
yes.
So
after
ito
the
walang
procedure.
bruises at
Yeah,
all?
wala.
Hindi ka
After,
nagkapasa-pasa ito?
After the procedure, wala. I can go out.
Mhm.
Akala
Pwede
ko hindi ako
gumimik, ah?
makakalabas.
Hindi naman siya magang-maga after.
Hindi, actually, hindi
Okay.
siya nagmaga.
Uh-huh.
Basta alaga lang with the
Ice pack,
Ice pack,
right,
right.
right. How long did you see, how long after the procedure did you see the
The
results?
result.
Well, right after the procedure, makikita mo ng lumubog.
Okay.
Oh.
Tapos, as time goes by, habang nag-heal siya,
Umiimpis pa siya.
Yeah.
Oo, kasi may swelling pa
Habang
eh,
nakikita
tama
ko
ba?
nga si Miss Farina, makikita mo yung shallow area dito sa
Oo.
below the cheekbone, no?
Oo. Actually, naging mas prominent nga yung cheekbones niya, which is nice.
Yes.
Kasi hindi na niya kailangan, I mean, for girls, especially for girls like, us, diba? Kasi kailangan natin, pag nagme-makeup kasi kami, may contouring.
May
Si Miss
contouring.
Farina, I was asking her a while ago, nagko-contour ka ba sa makeup?
right
Hindi na siya
now,
nagko-contour.
after the procedure, hindi na. Kahit walang makeup,
May
yung
shadow talaga.
siya na
May
lubog
shadow.
na.
Oo. Wow.
Dr. Lau, ano pa mga preparation niya before, let's say, if a patient wants to undergo this kind of procedure, we call it facial contouring or removal of buccal fats, ano ba mga preparation or requirements sa isang pasyente before undergoing this kind of procedure?
May mga clearance ba yan?
Actually,
Or-
wala. Kasi gising ka na gagawin to.
So it's just a minor procedure? like
Yes,
that?
It's a
very,
very minor
minor procedure. The
So you mean the
would-
patient is awake?
Yes,
Awake.
the
Okay.
procedure would only last 15 to 20 minutes.
Mabilis lang.
Sobrang mabilis lang.
About yung mga may mga problema sa ngipin or let's say may mga mouth fungal problem
Oo,
or
may mga
whatsoever.
mouth sores, okay lang ba yan?
If the patient has dentures, siyempre pinatatanggal namin.
Okay.
Pero kunyari may lesion doon mismo
Lesion
doon sa
area.
sugat o may singaw na malaki doon sa mismong paghihiwaan, we would delay the surgery muna.
Wag muna.
Pagagalingin muna
Pagagalingin
namin. Yun lang
muna.
ang requirement. Wala naman siyang kailangan na pa-laboratory or pa-clearance dahil very less...
Para lang itong
yes.
nagpabunot ng ngipin. Tama.
Mas masakit pa nga
Bunot
ang
ng
sinasabi
ngipin.
nila yung
Yeah,
pagpapabunod
sabi nga
ng
ni Miss
ngipin.
Verena.
Oo.
And then after the procedure, pwede ka nang umuwi agad.
Okay.
Just alagaan mo lang ng ice and then pwede kang
You're
mag-resume
good
ng
to
Sabi
go.
nga,
your daily
sometimes they
activities.
advise to eat ice cream eh. Para,
Afterwards.
parang binunutan ng ngipin, gano'n din, di ba?
Yes, kung ayaw mag-ice cream naman kasi ang sinasabi nila ayaw nilang tumaba naman pag nag-ice cream ng ice cream. Ice chips lang.
Ice chips.
Ice chips
Yes,
lang.
kainin mo lang yung ice chips, okay ka na.
Wow. Okay. Another question, Dr. Lau. Aside from buccal fat removal, are there other procedures pa to contour the face? Like,
Yes.
meron bang non-surgical? Meron pa bang iba? How about, kasi interested ako, yung sa jaw naman. Like, di ba, marami ding mga women na interesado sa, gusto ko medyo prominent yung jaw ko, or kaya, lalo na sa mga aging women, tama ba?
Right.
Gusto nila medyo nagsasag na to, gusto nila medyo i-lift. Meron ba tayong
Yes, for
procedures
the
that?
non-surgical procedure, we use yung botulinum toxin. Remember, yung buccal fat removal is fats ang tinatanggal. Dito lang po yung tinatanggal yan.
Oo,
Once
para
na kinapa
lumubog
nyo
to.
na po yun dito, pag kumagat po kayo, mararamdaman nyo, it's the muscle.
Yes.
We don't do surgery on the muscle. We use botulinum toxin. Yung
Botulinum
medyo sikat na procedure
What,
ito.
what does it do?
It
saan to?
paralyzes the muscle.
Okay.
Don't worry, hindi naman siya makaka-affect doon sa pagkain nyo. Makakakain ka pa rin. because-
Makaka-chew ka pa rin?
Yes, there's a lot of muscles naman na they function for mastication.
Okay.
And yung masseter muscle ang binobotox po, o linalagyan natin ng botulinum toxin,
Right.
nakakaliit po. In combination with the
lumiliit,
buccal fat removal.
How about
Right.
wrinkles? Can that be removed also?
Yes, actually, very
Wow.
popular siya sa
Sa skin naman
wrinkles.
ito.
And how long is the procedure? I mean, does it need to be
May
confined?
downtime ba to?
Downtime, confined the
itong-
hospital?
For
or-
botulinum toxin of the masseter and the wrinkles, the procedure 5 minutes only.
Ooh,
Okay.
5 minutes.
And 3
time to,
three
ganon.
injections lang.
Aha.
Actually,
Para ka na nagpabakuna ng
Okay, mga
botox.
ganun.
mas mabilis pa sa bakuna. And after injecting the botulinum toxin, halos wala kang makikitang procedure kasi 3 injection sites lang.
Okay.
The needle that we use is gauge 30, one of the smallest na needle. So, isang procedure yon. And then yung sinasabi mo sa mga sagging na skin, sa mga older women, I do thread lifting.
Thread lift.
Yes, we used or inject needles, and then when you retract the needle, may naiiwan na suture sa loob.
May
And
suture
that
sa loob.
suture is nagre-react siya to produce or to contract yung collagen inside.
Okay.
So we insert it dito sa jawline. Yung mga babae kasi kapag mapanga or ang lalaki mapanga.
Katulad si Ferina, sabi niya medyo mapanga nga daw siya.
Medyo sexy ang dating.
Right.
Medyo, yun yung stigma
So may
eh.
tinatawag
Kapag
na
mapanga ka.
parang facial triangle eh.
Okay, ano itong facial triangle?
Yung facial triangle, just like Brina, as what we were talking before, she got the facial triangle. Ay yung parang perfect face eh. Makikita mo yung parang triangle from the cheekbone up to the chin.
Okay.
Yung prominence ng kanyang cheekbone, no? Sige, focus ka natin si Miss Ferina.
Ayan, oo.
Prominence ng cheekbone, tsaka prominence ng kanyang chin. Makikita mo yung triangle prominence. So, yan ang perfect face. Ang
Ito pala ang mga...
Tsaka itong makita mo yung shallow area dito, ayan, no? Kitang-kita sa television.
Nako, maraming girls ang gustong ma-achieve yung ganyan.
Yeah,
yung
exactly.
prominent cheekbones na medyo shallow.
That's a woman's
diba?
dream, to have that
Para hindi ka nalalabas ng...
Oh, you don't have to contour na.
without even any makeup, you can easily...
Just to add up lang for our televiewers para masabi nila na paano sukatin if you have a perfect face. So ang pagsukat po is from the headline up until sa kilay, tapos sa nose, papunta dito, tapos dito po, papunta sa chin. Kapag yan po equal,
dapat pantay-pantay.
Yun po yung sinasabi na halos perfect yung face nyo.
May symmetry, tama ba?
Yes. Pag nagkulang po minsan, kunyari dito, doon naman sinasuggest na po namin na padagdag po kayo ng chin naman.
Another procedure.
Yes, which is chin augmentation. Kapag medyo retracted dito, parang masyadong, kahit maliit yung dito, medyo bilugan pa rin yung face because maliit yung dito.
Nilalagyan natin.
Yes, yun naman ang linalagyan namin. Pwedeng fillers or pwedeng implant mismo talaga. Yes.
Wow. This is a very informative topic, no? Kasi
Interesado ko eh.
facial contour, of course, is always a woman's dream or even man's dream to have the right angle. Kasi minsan, kahit anong angle sa camera, papakuha ka ng picture, sabi mo, para may problema, hindi mo maintindihan, no? Minsan, yung sabi nga ni Miss Ferina, very round yung face niya, yung kanina pinakita.
Naku-conscious ka ba before?
Yeah, kasi
lumalabas ka sa TV, syempre, di ba, lalo kang,
laruin mo yung angle mo kung
Right,
saan ka mo.
Kaya parang hirap lagyan ng makeup, no? Kinalagyan mo ng mga shadow.
Contour
Exactly.
pa talaga.
Tapos, syempre, obvious ang contour pag sa picture din eh. Kailangan.
Can we show Miss Farina's picture ulit before? Kasi I'm actually a bit amazed talaga of how...
Sa picture niya? I mean, para...
Kasi right now talagang para talaga siyang nagko-contour ng face. Yung before picture niya, yan.
There you go. Makikita mo sa picture, wala yung kanyang shallow area dito sa may mid-face, no? And parang
Tsaka mukha siyang,
yung face niya.
parang mukha siyang 15 years old dyan. Oo, kasi, di ba, medyo, kaya yung ibang women kasi is para look a little more sophisticated, di ba? Kasi mukha kasing teenager kapag
tapos
medyo
yung cheekbone niya, kung
chubby
makikita mo,
cheeks,
halos di mo makita, halos pantay lang
Oo, pantay ng cheeks.
mid-face niya, no? Yung fatty area.
Pero payat ka niyan? Payat ka niyan time na yan? Oo.
medyo.
Yung face lang talaga
Yung face lang talaga
nahihirapan
yung
ka pa payat.
problem.
And now, this is her face now. Can we... Yeah, there you go. Makikita mo talaga yung prominence.
Right.
Yung mid-face, pagkakatanggal ng buccal fats.
Saka yung sa side view, makikita mo yung lubog na yun.
Oo, meron talagang shadow.
Dr. Lau, ano bang magandang maintenance, let's say, for a patient who ayaw naman niya magpa-surgery, like patanggal ng buccal fat? Ano magandang maintenance for a woman in terms of non-surgical procedures other than the botulinum toxins?
Okay, we have yung RF nga lang. Medyo matagal nga lang. We have
which mamaya i-demonstrate natin at the second segment of our
the
show.
machine that we're gonna use later on is the Biotherm. Or
Okay.
Thermage. It's also our RF, but the difference is meron siyang suction.
Okay.
May
What is
suction
this for?
effect siya.
Ano para saan yung
So
suction?
kapag may RF, yung init for skin tightening, plus yung vacuum na sinasuction,
Vacuum effect.
Okay.
so parang hinahatak niya. Nakakatulong din for facelift, tightening.
So
Tapos,
parang instant facelift, parang non-surgical
Yes,
facelift.
non-surgical
ito.
facelift yung
Okay.
And I think it's
namin.
also activates the collagen formation.
yes, actually. Yes.
Because of the heat of the
For the
radiofrequency.
skin naman.
Yes.
For the
Oo,
skin.
okay.
And of course, the muscles, because there is a vacuum effect, so there is also a vacuum on the muscular area ng ng jaws mo. Siguro mamaya, si Miss Ferina, subukan natin yung tinatawag na biotherm dito sa face niya para makita natin lalo yung effect ng facial contouring. Other than botulinum toxins, these machines, ano bang magandang parang facial home remedy para sa ating mga pasyente, Dr. Lau?
For the home remedy, medyo, siyempre, diet and exercise.
Yun, importante. Tsaka rehydration, no?
Yes.
Rehydration
Kung
pa
kaya
rin
na
sa skin.
pag nag-diet ka at lumiit dito, good for you. Pag hindi naman lumiit, look for us.
Pero alam mo, naririnig ko lagi kasi sa inyo kapag nag-a-advise kayo sa mga patients na kapag kunyari naglalagay ka ng toner or kapag nag-wash ka, dapat laging pataas.
Yes.
Diba? Naririnig ko yun sa inyo eh. So, anong reason kung bakit kailangan? Laging naririnig ko yan eh. Like, apply the toner ng pataas, upward movement. Dapat pag nag-wash ka ng face, dapat upward movement din.
Yes, because as we grow old, siyempre due to gravity and yung collagen inside sa ating katawan, nawawala na, nagsasag.
Okay.
So as much as possible, even bata ka pa, try to practice na when you apply something on your face, laging upwards. So nai-stimulate yung... So eventually, hopefully, at pagtanda mo, yung kakaganon mo is nakakatulong.
Okay.
Less yung sagging ng face mo.
Another question is, may mga patients din ba kayo na mga guys naman na nagsisik din ng consult for facial
actually,
contouring? Ano bang mga procedures?
nag-boom talaga siya during a movie na si Derek Ramsey. Remember na na-focus yung face niya sa isang movie na sobrang chiseled, right? Prominent ang cheekbone, lubog na lubog to, ang ganda ng panga.
Okay.
After that, napakadaming guys na lumapit sa clinic na, Doc, gusto ko po lumuit yun dito.
Gusto ko Derek Ramsey.
Yes,
ganon,
kasi medyo pag tinignan ng isang guy na chiseled, sexy ang tingin.
Okay.
Yun yung...
Okay.
Wow, that would be a very nice topic.
Yes,
Maybe later on, our next segment will be featuring the actual facial contouring using a non-surgical procedure.
It's called biotherm.
Biotherm.
Yeah.
And of course, together with us, our source person, Dr. Rayran Lam. Of course, our beautiful
Miss
model,
Ferina.
Miss Ferina De Paz. And of course, together with our staff. And we will be demonstrating again the vacontour.
Yes.
Ayan,
No,
live.
biotherm, yes.
Biotherm.
Iba pa tong vacontour next episode yung vacontour.
So, okay, Dr. Lau, maybe later on, can you be with us again together with the demonstration?
Definitely.
And of course, to our televiewers, please text us at 0922-891-6761 if there's any for your comments or suggestions. And please indicate your name and your location where you are right now.
Pero before we go into a break, I just want to ask Ms. Ferina, like, if you have, like, ang famous question natin dito sa mga guests, sa mga pretty guests natin, what's the best advice or best remedy for your skin or for your face that you can give to our audiences?
Well, for me, I drink a lot of water.
Okay.
Tapos,
Hydration.
do the 5-step, yung cleanse, moisturize, exfoliate, sunblock.
Yes.
Yung mga ganon.
Yes.
So, yun lang. Kasi, tsaka less exposure sa sun. Kasi, pansin ko parang mas madali ka yatang mag-aging.
Right.
Babad ka sa araw.
And if you'll be exposed to sun, siguro sunscreen na is the best.
Sunscreen.
Okay, so we'll be right back when What's Up Doc returns.
Natural look nose lift, cleavage by breast augmentation, curves by liposuction, non-surgical treatment of varicose veins, Janssen Cosmetic Surgery by Dr. John Cenica.